I had your colleagues in the studio. We went through some Dr. Lassie and Dr. Akafo.
Yeah, Kafka.
Right, yeah. We did great stuff, but we realized we hadn't even scratched or rubbed our eyes at all. All right, so we are happy to have you here with us today.
Thank you.
We talked a bit about screening last week, but let's start with that. Typically, when they say there's an eye screening exercise or event or campaign going on, what does it entail? Any one of you can start.
Okay, so good afternoon to your listeners.
Right.
So basically, eye screening it's just taking a look at the eyes
Mm-hmm.
to see if they are healthy or not.
Okay.
And so, in the process of screening, we look at all the various parts of the eye,
Mm-hmm.
how well the eye is seeing, and then if there are any diseases that you may not notice yourself.
Right.
Yes.
Okay.
And we are able to pick that up.
Okay. Which means that when I see my eyes, at least in the mirror, right, or when anybody else sees my eyes, they are not likely. They don't have the skill to pick up any abnormalities or problems with my eyes. But you're saying by looking at, examining my eyes,
Examining the eyes.
getting me
yes.
to undertake a few tasks or exercises, you can pick out whether there is a problem with my eyes and my eye health.
Sure.
Wow.
Because most of the time, a lot of the eye diseases are not seen from outside.
Okay.
So just looking at the eye, you may not see anything.
Mm.
So unless the person notices that, oh, and because the eyes are two, it's difficult to tell if
Right.
one eye is defective.
Right.
Unless you maybe mistakenly just close one eye one day and you realize that, oh, this other eye doesn't see well.
Okay.
Or
Which you're
it's-
normally not likely to
which
do.
usually people don't do. So
Right.
a lot of the time, you would not even notice that one eye has a problem until you get tested.
Okay.
So
Okay.
that way we are able to identify the problems. And because most of the diseases are within the eye,
Mhm.
it's really difficult for anyone just looking at the eye to
Okay.
detect that there's a problem.
Right. We learned last week that there were different, should I say, recommended frequencies for screening for children and adults. Okay. How often should the average adult have their eyes screened?
Okay, so it depends on what you want to screen your eyes for.
Right.
I mean, if you just want to find out whether your eyes are okay or not, you could take anything from like twice a year to like yearly,
Okay.
yeah, to have it checked. And it's for some people who wear glasses, you know, so sometimes you go like say every 2 years
Right.
just to see whether they need new prescriptions or not.
Okay.
Yeah, but because we have a lot of people now developing glaucoma, which is a very serious disease of the eye, which can cause blindness. We advise that, I mean, every now and then can pass through an eye clinic and let the pressure in your eyes be checked.
Okay.
Yeah, so if it's high, we can start treating as early as possible.
All right. You brought in pressure. So what about the pressure on the eye clinic? Can you just walk in and say, I need my eyes checked? The average eye clinic. I see people sitting and waiting and stuff like that. Is it that kind of situation you are encouraging, that people should walk in and ask or request for their eyes to be tested?
Yeah, sure. People can
Yeah.
do
You
that.
can?
Yes,
Yeah,
you can
should be.
do that. You can walk into any eye clinic. I think most of the district eye facilities and some of the private facilities
Okay.
also can do that.
All right.
Some also may not be able to do because many of them are offering just optical, like
Right.
doing glasses
Okay.
and those kind of things. So some may not be able to check, but for most of the eye clinics, yes.
Okay.
they-
Now that
they
brings
are
me to my
able
next
do
question, which is, well, who should be testing or checking or screening my eyes? I know you are ophthalmologists,
Yeah.
right?
Yeah.
Then we have the optometrists, right?
Yeah.
that. Yes.
Right. Can we
Yes.
distinguish and give our listeners a sense of a reckoning on who should they be seeing to screen their eyes properly, competently, and professionally?
So there are a number of professionals in the
Okay.
eye care. There are
Right.
quite a number.
Optometrists, right?
Yeah.
That's what.
so
yeah, I got it
almost
right.
all of them start with an O.
Yeah.
Yeah. So you have like ophthalmologists. They
Right.
are like medical doctors
Mm-hmm.
who, after having a basic training in medical school, have gone ahead to specialize in diseases of the eye
Okay.
and to do surgeries on the eye.
Okay.
Then we have the optometrists. So optometrists generally will have their work has to do with refraction. How well you can
measurement.
see, to measure how much
right.
you can see, whether glasses will help you,
Okay.
what kind of glasses will help you, and
Okay.
all of that. Yeah. In some places, they offer additional services like managing certain minor eye conditions of the eye.
Okay.
And then we have also ophthalmic nurses.
Right.
So ophthalmic nurses are also general nurses who have gone ahead to specialize to get further training in eye diseases and how to take care of eye diseases.
Okay.
So in certain hospitals in the district, even in Accra here, you have ophthalmic nurses managing the eye unit. Sometimes you have optometrists also managing the eye unit.
Okay.
And then we also have people we call opticians. So opticians are more or less like the technical guys. They are the ones who translate the measurements that the optometrist or the ophthalmologist have already measured into the glasses that you can wear.
Right.
Yeah. So you have all these people working, in the eye unit.
Okay.
But if you want somebody to give you a comprehensive eye examination and give you a very good advice on your eyes, you need to speak to an ophthalmologist.
Okay.
Unfortunately, we don't have so many in Ghana.
Did you say fortunately or unfortunately?
Unfortunately, we don't have so many in Ghana. But in Accra, we are blessed to have a bigger chunk of the numbers in Ghana.
Okay.
Yeah. So in most eye clinics, you should meet an ophthalmologist once in a week or once in a while.
Okay. Listeners, if you just joined us, it's about 18 minutes past the hour of 2 on Joy 99.7 FM. The program, as always, on a Sunday afternoon is Ultimate Health, your ultimate guide to healthy living with me, Norte by Nature. I'm in the studio with two ophthalmologists, right? Dr. Alex Addo is a resident ophthalmologist with the Kolebu Teaching Hospital. Dr. Nafisa Rita Mahama, powerful name. She's a specialist ophthalmologist at the Adan East District Hospital, right? I'll be finding out from her what it's like, especially a specialized facility like an eye unit or eye center. What do you call it? An eye center or eye unit?
Yeah, eye unit.
Okay. Right. Outside, a regional capital and so on and so forth. Let's see how that goes. But let me come back to this question of who should be checking your eyes. There are guys sitting on the roadsides. There are small shops and places where, you mentioned opticians. They sell the corrective devices, right? And they have technical knowledge as well. Okay. So when you have a prescription based on a competent assessment, then the translation of that prescription into something which is corrective, right?
Yeah, exactly.
My understanding is that the optician handles that.
Yes.
Okay. Yes. So whilst being technical, that's largely what? Is it commercial as well? You're selling products, not so?
Yes.
But they must have technical competence.
Yeah, so their training is, it's broad.
Okay.
But essentially what they do is to give you the glasses that you're wearing.
Okay.
Yeah, so you see the doctor or the optometrist tells you need maybe +2 to read or to see well.
Right.
With that prescription, it's of no relevance to you. So you see the optician, and the optician translates that into the glasses that you wear.
Okay.
For you to see well.
Okay.
Yeah. So that's what the optician does.
The thrust of my inquiry is that when you set up a pharmacy, right, you're required to have a pharmacist alongside other categories of personnel. So these people or enterprises we see by the roadside, sometimes under trees, they even have the charts, the letters and all that on some, it looks like a bed sheet or something, or they're doing business. I'm just trying to get you understanding. They claim to be doing some form of screening or assessment, and they generate results, and sometimes they even sell the products. What would you say to my listeners about this? Because you've already said that there are not that many of you guys, right? So in the gap, we have all this going on. Dr. Nafisa, you are out there
in
the district. What's it like?
For most of these people, or let me say many of them, the screening they do is basically, visual acuity, like how well you can see with your eyes.
Okay.
And then try to use some lenses to see if they can improve your vision,
All right.
like how well you are
So if
seeing.
you have a visual defect or deficiency,
They are
then-
able to measure that by checking the visual acuity.
okay,
And then subsequently they use the lenses. We have some we call them trial lenses.
okay,
They can use that to try to see if they can improve your vision.
all right,
So that is essentially what they do.
okay.
But there are so many diseases of the eye that let me say that aspect of we call it optics or optometry.
Right.
Those refractive errors are just a small
The tip of the
proportion,
iceberg.
yes, of
Right.
eye diseases.
Okay.
And so those people are not able to determine to a large extent if you have disease in your eye or not.
Okay. They would
Yes.
deal with the fruits, but not the roots.
Yes,
Yeah.
they would not be able to tell you that you have this or that.
So you can give me corrective lenses that correct or improve my
Your
impaired
vision. Yes.
but the root cause may not have been identified
Sure,
or
sure.
addressed.
Sure.
Okay, I like that.
Sure.
Listeners, I hope you're capturing this. This is very important because Obia Pekona fast. You go there, why should I go and see a doctor? Why specialist? Why? When right at my junction, right? It's happening live and I've been there and I'm fine. What we're saying is that yes, visual acuity, right? How accurately you see, right, can be measured and can be corrected to some extent. But we are also concerned about diseases and disorders of the eye. And there are people with the requisite training and competence and experience to identify those things. If you have any questions, concerns, 055 1111 997, Ultimate Health on Joy 99.7 FM. I'm told that YouTube is not functioning today, but we're live on Facebook, and we'll also activate the phone line shortly. So you're welcome. We're talking about loving your eyes. A follow up to the World Sight Day on the 13th of October, which we missed. We let it flash by, but now we are focusing, zeroing in on it, and we've got another pair, male and female ophthalmologists in the studio, right? So if you have any questions, concerns, you can WhatsApp 055 1111 997, and let me announce the phone lines anyway. 0302 216 541, just in case you want to get in there. All right, we've talked about how well you see your acuity, right? We hear of 2020 vision. 2020 vision. What does that mean? Is that balancing the vision you have in each eye, or what is this 2020?
Okay, well, so it's a way of recording.
Okay.
I mean, how well you can see, so
Right.
that anybody who is trained in that field can understand. You know, because when I measure your eyes, I should be able to write it in such a way that Dr. Mahama, who was not there when I measured, will see and then
Right.
understand. Yeah, so there are several ways of recording it.
Okay.
You know, one of them is the 2020 that you've mentioned.
Right.
You know, so I mean, 2020 is when you are measuring and you're recording it in feet. So what we do is that we compare your vision to a standard vision,
Right.
and that standard vision is we assume that if somebody with a good vision
Right.
can see a particular optotype or object
Right.
from 20 feet, if you also have very good vision
Mm-hmm.
and you can see it from 20 feet, then your visions are comparable.
Right.
Yeah.
Okay.
So anybody who cannot see the same is recorded differently. So if you can see the same object that somebody with 20/20 vision is seen at 20 feet, and you can see that, say, at 30 feet, then we record it differently.
Okay.
We record that 20/30,
All right.
and so on and so forth. So we can also record that in feet, in meters.
Okay.
That one is equivalent to about 6 meters.
Okay.
So when you see those numbers, they're just a way of recording how well you can see, so that anybody who sees it anywhere in the world
Okay.
will understand. And these are standard measurements used everywhere in the world.
Right. Our eye standard across the world. When we say 20/20, I know blood pressure will say 120/80 with a variance or a range, right, or a margin. So we're saying that averagely, if everything is well with you and your health and your eyes, then you should be within that 20/20, using this metric you just explained, right?
Yeah,
And then
more or less.
we'll be interested or concerned with variations or deviations from this average.
Exactly.
Okay.
Yes. Yeah.
Those of you who did statistics, mean, average, central tendency, and then dispersion. How far are you away from the norm?
The norm, yeah.
Right? So we've broken down 2020, but I know you will have your own questions you want to ask. 055 11 11 997. Facebook is active, and my phone line is 030-221-6541. You can speak to the ophthalmologists in the studio, Dr. Alex Addo and Dr. Nafisa Rita Mahama. When people mention your full name, all right, okay, so we've understood that, right?
Exactly.
Okay, so you can go in thinking and understanding that you're having a regular eye screening or eye check. There was a time I had a check related to my prescription, and I think she was an ophthalmologist, but she was so close to me for so long, right? And I could hear her heart beating. I could feel her breath on my face, and I'm like, hey, what has she seen that I can't see? I was getting worried. So I asked her, is anything wrong? She says, no, you're quite okay. I said, well, you're on one eye for quite a while, right? You may go in thinking you're doing a typical, normal, regular screening. What are the common presentations? He's already highlighted glaucoma. We'll come back to that. But what are the common things we find wrong with people's eyes in our part of the world, or even generally?
Oh, okay. So, a lot of the things we see include allergies.
Allergies.
Yes.
Okay.
So
Eye allergies.
Eye allergies.
Okay.
Yes, relating to the eye.
Mm.
Then we have other common ones like cataracts.
Mm-hmm.
So cataract is basically clouding of the natural lens in the eye.
Mm.
So everybody has a lens in the eye,
Mm-hmm.
and so for some reasons the lens becomes cloudy,
Okay.
and that is what we call cataract. So it's one of the common things that we see, and it's actually the number one cause of blindness in Ghana.
Cataract.
Okay.
Now,
Yes.
Dr. Nafisa, I mean, if this is happening to my eye, right, what would I see? Are there signs, symptoms? I know you will examine and pinpoint it, but would I see anything? I mean, okay, I'm moving my phone further away to read WhatsApp and so on and so forth. What would I sense or experience if there was a cataract
Okay.
underway?
So oftentimes when it starts initially, you are not able to see it.
Mm-hmm.
But with time, as it increases, the cloudiness progresses.
Okay.
It becomes whitish. So you realize that in the eye,
Mhm.
a portion is supposed to appear dark.
Okay.
But then you start seeing some white, something that appears whitish in your eye.
Okay.
Or on your eye when you look into a mirror.
Mm.
Or somebody else looks into your face and sees that, oh, one eye, there's some white thing on it.
Okay.
That is one way to detect it.
Okay.
The other thing you may realize is that your vision has become blurry.
Mm.
So you used to see clearly, but then with time it seems, oh, my vision has become so blurred.
Mm.
Some people will describe it as smoke, as if they are seeing some smoke.
Okay. Right.
So mostly that is a presentation of cataract, a change in the vision, and then maybe appearance of that whitish.
Okay. Great.
Something.
Dr. Addo, we had guests last year, Dr. Jifa, Ofurieje, I've forgotten the names now. But we had a couple of them. But one of the things they said was that it's quite easy to solve cataract,
Yes.
right?
Yes.
They were talking about walk-in clinics and people doing stuff. They did some stuff in Cape Coast and so on and so forth. Is that the case?
Yeah, that's the case. You
Mm.
know, it's unfortunate that many people, suffer from blindness or low vision, and which affects their life from cataract alone. And that's because cataract, for most cataracts, a lot of them, you can just do a surgical procedure and then their vision is restored. And it takes, from in an experienced person's hands, about 30 minutes or less to maybe an hour. And then it's a same day procedure. Usually you don't give a general anesthesia. You are done, you go home. And then beautiful thing about cataract surgery is that the next day, the person can tell you the result of what they've done. They'll
But
see
yet still
a clear difference between how they're seen before and now.
Right. But yet still it remains very prevalent.
Yeah, it is prevalent because one of the main
Is it
reasons
because of ignorance or what is it?
because it's as a result of, most of it is as a result of aging. A large number of people who have cataract. It's a natural thing that would have occurred, yes,
Right.
with aging, and especially because in Africa we're exposed to a lot of ultraviolet light from the sun. So a lot of people in their lifetime, at one point in time, will develop cataract, which is significant enough to give them some form of reduced vision.
Right.
Also, is because a lot of people feel that when they do any form of surgery on their eye, they'll become blind. And that's a misconception.
So fear.
Yeah, there's a fear.
Ignorance,
The
miseducation.
fear, the ignorance, yeah. Even amongst educated people,
right?
There's this misconception around that when you have any form of surgery on your eye, you end up being blind from the surgery. Yes,
right.
But there are so many people whose lives have been changed from cataract surgery.
You just walk in, see the right person,
and
qualified, and it's done.
It's done. Yes.
30 minutes.
Yeah.
By which time I wouldn't have finished an order of banku and tilapia, right?
Exactly, yeah. 30 minutes is even too... 30 minutes in the hands of somebody who's moderately advanced.
I'm joking with it, but it's a very serious thing to emphasize that it is treatable.
Yes.
It is effectively treatable.
Yes.
And people are walking around with that on their eye, and you see it.
Yeah. And
right?
Cataract surgery is one of the surgeries in medicine that has the highest...
success rate?
Success rate. Yeah, that's the word I wanted to use. Yes.
Right. So, hey, we got our eye on issues related to the eye, and you're welcome to join us by phone 0302216541. WhatsApp is 05511119997. Oh yeah, in Athenia, I see ya. And then why are you late, Kakra? It means you're already eating. But I'm invited into your home. This one says, "Good morning, Norte. Please ask the doc for me if surgery is the only way to get pterygium out of your eyes, and what happens if it has been there for a long time." You see, I love my discerning listeners. So they ask the question in a way that you yourself, if you don't know, you will listen to the doctors. You won't rush. And this is not some online place where people just talk anyhow. Right. Pterygium, right? Have I pronounced it right?
Pterygium.
Pterygium. Okay. Oh, yeah, I saw pterygium. Okay. Pterygium.
Yeah.
Oh, you are. So, how do you get that out of your eye? What is it? How does it get there? And then what if it's been there for quite a while?
Okay, so pterygium is basically a growth on the eye. So a portion of the white part, which we call the conjunctiva, is overgrowing onto the dark, the part that appears dark. That's the cornea. Okay, so it's just an abnormal growth, and the only way is to take it off. By surgery. Right. That's the only way. We don't have medication that can melt it or let it disappear. The only way is by surgery. And it's also a very simple surgery, just like the cataract surgery. Yes, you just go in and take it off. Yeah. And if it's there for a long time, it will just keep growing. We can't say how long it will take to grow. But it will grow gradually, and then it can extend all the way to the other side. So usually it starts from the nasal side, and then it grows towards the center of the eye. And if nothing is done about it, it can actually grow and extend to the other side. And by that, it will cover the eye and you can't see again. Right.
So it can be sorted. It continues to grow if there's no intervention, and it can be dealt with effectively. Please, anytime I wake up in the morning, my eyes become teary for some few minutes, then it stops. What could the problem be, Michael, on the Spintex or from Spintex?
I think Michael should visit an eye clinic to have a proper assessment. But if he says his eyes become teary early in the morning after waking up, it could be that he's suffering from dry eye disease. Maybe when he sleeps, his eyes don't close fully, so they are exposed to the ambient air, maybe the fan he sleeps under and all of that. So it's upon waking up that he's aware of it. But otherwise, I think he should have his eyes properly assessed.
Have it checked. Michael from the Spintex area. I know people whose mouths don't close when they sleep, right? Eyes not closing properly. I've heard about that. Sometimes has to do with the size of the eyeball and many other things. Huh?
Yes, yeah.
Well, you know me. I use humor to make sure you remember what we discuss. But if you do have some of these problems, do have your eyes checked. And then the properly trained people can tell you what you need to do. I've got a thesis, sounds like one of the vice president's lists. From Douglas in DC. Ever since he got to know my full name, he types it. How often do we have to visit the eye clinic? Douglas, you asked this last week, and I think it was answered or somebody else asked. But we just touched on that as well. How do you get your clear or white eyes? Right? Or white eye, he says. Okay? Many believe the eye should be white. We'll come to that. What type of eyeglasses are used for both reading and prevention of dust? This is one man's list of questions. Any eye drops good for clear eyes? There's even a product called Clear Eyes.
Yeah.
They play on... anyway, what should those who sit by the laptop or desktop for a long period of time do? We had that last week. Take a break. Rest your eyes. You're straining your eyes for too long. Please take the questions one after the other. Douglas, open your own consultancy and go and see a doctor. But anyway, let's take it from the top quickly. Let me just see if I have any others, because Douglas tends to hog the show with his plenty. Good afternoon. This one says, please, can you educate us on RP? Right? Okay. They are nodding, so I don't have to worry about what RP is. Good afternoon, Naughty and the professionals. Please, my eyes sometimes feel like I've sand on them, especially when I stay in a bright area and I end up having water. I guess they become teary as a result. This is from Ni Aite in Bubuashi, right? Okie dokie. Okay, we are in business now, and the day is typing in Maryland, and then there's one from somebody in the UK. Let me see if I can get a name. There's no name. Okay, Moorfields in London says, Dr. Ado says we do not have enough trained doctors, nurses, optos, and opticians. Is it possible for the wayside opticians to have proper training to pick minor eye diseases yearly to help out? This is from Doris. She's an ophthalmic eye specialist, Moorfields in London. You know, in the past, we did some work with traditional birth attendants. We did some work with the Wanzams, recognizing our deficiency in numbers and training. Is this something that's been considered?
Well,
no, we're not putting you out of business. We're just she's suggesting something.
Well, I think it's a good suggestion, but I mean, it's not as simple as it is. We have to look at a lot of things. I mean, those by the roadside, they didn't have any form of training at all and all of that. So we have to look into all of those things. But I think it's a good suggestion. If we have those people out there and people trust them enough, then maybe we can also liaise with them.
We did some great stuff with the Wanzams. I've had them in the studio.
Yes.
Yeah, and the traditional, the TBAs.
Yes,
right?
yes.
So you guys look into it, eh?
So
we can photocopy some of you.
Yeah, there's an aspect of eye care that we call primary eye care.
Right. Okay.
So primary eye care has that component of training non-eye care professionals to be able to identify certain basic,
limited range of
certain basic eye diseases and then refer appropriately, or even be able to assist on how to go about it
and then
at the community level.
Right. Then we can certify or license them for that limited function.
Yeah.
Oh?
I think that
Alex doesn't like that. Right. Alex doesn't like that. I can see on his face. All right. Let me come back to very quickly Douglas's list. So how often do we visit the eye clinic or for screening? We've handled that. Can we just hit on that once more? Just quickly.
I mean, so it depends on what condition you have. So if you visit the doctor for the first time, he will probably give you the next day to come up here.
Okay.
Depending on what condition you have, you'll be given a date as to when to come. But I mean, it's for regular checkup. I mean, I'll advise once a year or even twice yearly. It's fine. Yes.
All right.
That if you have no eye condition, but you just want to be sure everything is fine.
Okay. What's this business about white eyes and clear eyes? Is the eye supposed to be white?
Oh, not necessarily.
Okay.
Yes, because People have different colors of the eyes. I'm not
Mm.
too sure what you mean by a white eye, but if it means a conjunctiva,
Uh-huh.
there are some. I mean, children usually will have white eyes, but
Okay.
as they grow up,
As they lose their innocence.
more or less, yeah.
When they've
But
seen things. Eh?
no, but as they grow up, I mean, and because we're exposed to a lot of things,
Environmental
environmental
exposures.
factors like
Okay.
dust,
Yeah.
people rub their eyes and all of that.
Okay.
The eyes gain some pigmentation.
Pigment. Okay.
So depending on how much pigmentation you have in your eye, your eyes might look brown or
Okay.
less white
All right.
compared. Yeah, but if your eyes are red,
Mm.
then that's a problem. So you need to find out why it's red.
Okay.
But
All right. These products that claim to clear the eyes, claim to address red eyes, and so on and so forth. Are they doing anything good? Are they? Well, I guess they probably licensed or registered as some products. But what is really the issue they are addressing?
So basically, some of those products are supplements,
Okay.
food supplements, and some contain certain vitamins and minerals that help with the function of the eye.
Okay.
Some also contain certain omega-3 fatty oils. Okay, that's also, there's actually research that backs
They are good for the eyes.
them. Yeah, that
Okay.
they are good for the eyes.
Okay.
So a lot of them basically they are just supplements.
All right. Okay. The one about laptop, we handled that last week. And Douglas, go and look up last week's program. But we were told that if you rest, shouldn't strain your eyes on a screen for too long. Rest, move away from it, or take your eyes off it for a while, and then that should rest and reduce the strain. This is from Dede in Maryland. Heavy wind blow, right, causes my eyes to tear. People have a problem with tears, and they want to know why their eyes tear up. This is in response to a strong gust of wind, I guess,
yeah,
right? I guess that is an irritant to the eye. Is that
Yeah.
a normal reaction that when you have something like that, you would tear up?
yeah, it's normal. I mean, tearing when the wind blows over, it's the eyes reacting to the
It's
situation.
protective.
Yes. So
Okay.
when the wind blows over the eye over a period of time, the surface of the eye becomes dry,
Okay.
and then there's a reflex
Okay.
of the body to produce more tears to moisten the surface of the eyes.
All right, Dede, you're normal so far. Does laser eye surgery correct the problem for life? I don't know which problem, but does it correct it at all or worsen it? You're talking about a mode of intervention, right? I don't know whether it is used for only one condition, but it's like an omnibus question. Is it effective? Laser eye surgery. What is it, and does it? I mean, I know it's a modality available.
Yes, so mostly laser is used for refractive correction of the eye.
Okay.
So instead of using glasses, some people who do not want to use glasses prefer to have surgery done to correct.
Okay.
So for procedures like LASIK and others,
All right.
they use laser to do some treatments of the eye.
Okay.
Yeah, and it actually works.
Okay.
It works.
All right. They have tried to package it in such a way that we can get you a meaningful answer. If not, I know you'll be typing very soon. Does the blue light in glasses really work? This blue light came up last week as well. Blue light.
Those blue eyes.
Something came up last week about blue light. We talked about progressive lenses, and then the blue one came up. Are you able to respond to that?
I'm not sure, but
Okay.
probably some UV protection.
Right.
I don't know.
Okay. Right. Dede, I hope we've done justice. Phone line is still active. Many of you want to consult for free by WhatsApp. Okay, that's also good. But do make sure you visit a facility and see the professionals. Okay, that's very, very important. Don't get all your responses and consultation on the radio and then feel that you don't need these guys. They train for a purpose. 0302216541. My phone line is still active. Ultimate Health on Joy 99.7 FM. We're learning how to prioritize eye health and eye care. What causes itchy eyes more than Dansoman? Okay, we had somebody in Bubuashi also talk about dry or itchy eyes. I'm not saying anything about your locality. I'm just saying where the questions came from. And itchy eyes. Can we hit that quickly?
So itchy eye is what Dr. Mahal mentioned in the beginning as one of the common causes we see.
Okay.
It's what we call the allergic conjunctivitis or allergic eye disease.
Okay.
So, I mean, it's just basically the eye reacting to something in the air that's gone into the eye.
All right.
Yeah, so it's the same as when people inhale dust or anything, they feel itchy in their throat or they sneeze a lot. Yeah.
All right. Okay, so it's a reaction. Yeah. Please tell Dr. Nafisa, this one says Nafisha, that her JHS 3 maths teacher will visit her. Good education from them. Felix Dezu Amasaman. Hey, Charlie. You see, he's coming to visit with authority. And not even just JHS or your school teacher. JHS 3. Do you know him?
Yeah, I know him.
Then prepare. Okay. Okay, Doris says something, but I don't see whether. Okay, this is they should be on a register, and without the yearly update, they can't renew the license. This is with regard to the lower training of lower or unqualified. Let me call them practitioners in quotes. All right, with some reticence. Okay, great stuff from my listeners, Maryland, UK, Charlie, you're bad, and then of course Dan Suman. Right, my doctor said she can see a round circle at the back of my eye, which is bigger than the normal. Therefore, requested that I do these tests: CCTs for RNECA or Reneka, VFT, CCTC. Kwame Dansoman. He's put his doctor in the witness stand for cross-examination. So the doctor could see or identify a round circle at the back of his eye. I guess this was how it was communicated to him, and recommended some tests. And he's listed these things. What can we quickly say to Kwame other than listen to your doctor?
Well, I think I think I when I put myself in the doctor's shoe, I think he suspects glaucoma that he wants to get a hold on.
Right.
So these tests are good. You should do them and then see them.
Okay. Yeah. Right. Tests are to identify, eliminate, whatever, specify whatever you think is wrong. So, get the test done. I hope you have gotten them done, and you will be going back to your doctor. But it's not a review, peer review panel, right? But it's glad you shared, and other people also learned from what you shared. If you have glaucoma, what treatment do you have to do? This is from Nana Edu. Glaucoma comes back. We said it's quite common, right? What is it? And then that's a whole program in itself. But then, what is it? And then what can be done about it?
Okay, so glaucoma is a progressive disease that affects the nerve in the eye, which enables us to see, and it's one of the major risk factors that we are able to target our treatment towards is the increased pressure in the eye.
Okay.
So for most people with glaucoma, they have increased pressure in the eye.
All right.
And so the treatment is targeting to bring down the pressure and protect the nerve so that it can continue to function.
Right.
So there are various glaucoma treatments. We have medical treatments, surgical treatments, and then some laser procedures
medical
as well.
Meaning pharmacological?
Medical meaning we are using medication,
drugs.
so like eye drops or tablets that we can take. And then we can also do surgery to correct if there is any problem in the eye, or to create an alternate passage for the fluid in the eye to drain through.
All right.
So sometimes it's basically a build-up of pressure because the fluid in the eye is not able to drain out.
Okay.
So we create an alternate passage during the surgery to allow the fluid to drain, to bring down the pressure. Okay. And then we can also do some laser procedures. Okay. Also aiding in bringing down the pressure in the eye.
I had to say eye vulcanizer. You check the pressure, so the eye must have a certain
there's a normal range of pressure, just like the blood pressure,
right? Yes. And if it exceeds that, it will affect your vision,
and
also compromise
it damages the
eye
nerve
health.
Yes.
Right. Okay, so that essentially is what you're dealing with when you're dealing with glaucoma. Okay. Hope you've had your stuff answered. Wow, we're still focused and still learning, wow, lots of these. Good afternoon, Norte. Anytime I take in red wine, my eyes itch. All right, Papa and Sam from Latte, leave the red wine alone, right? But let me find out why. Is there any relationship alcohol, or he says red wine? He doesn't say what happens when he takes aquateshi. So the question is on red wine.
Red wine, yeah. So I mean, a lot of people have allergies to many things.
Yeah. Okay.
So it's very possible that if he's learnt or he's realized this association between the itching of the eye and the wine,
Okay.
then there's something in the wine that his body is allergic to,
Okay.
and it's expressing itself in the eye.
Okay. All right. Somebody wants us to explain. Oh, where is it now? Oh, I saw it. Something about eye donation. Good afternoon. Please, I have a diagnosis as pale disc from outlet. Explain. Also, I have low vision on the right eye, and I've been told that can't be corrected. Kwame, please also explain eye donation. And they send these in around like 255, 252. But anyway, right? So pale disc for outlet. Does it register with you guys? Pale disc.
Well, we have something called pill disc.
Yeah.
Okay.
For outlet.
Okay, let's deal with pale disc.
Yes, so pill disc. So everybody has a normal optic disc
Okay.
that should appear pinkish.
All right.
So it means that there is good blood supply, and it indicates a healthy optic nerve.
Okay.
So if you have a pill disc, it means that the nerve is not healthy.
Okay.
Yes, so the cells within that form the nerve are not healthy.
Okay.
And so definitely your vision will go down.
Okay.
Yes.
Right. And then he says he has low vision in one eye, in this case the right eye, and he's been told it cannot be corrected.
Yes, so
Right.
so most likely the low vision is coming from the optic nerve
That is
disease.
damaged.
So
Right.
the optic nerve is damaged. Yeah, that's the right thing. It's damaged, and so the person is unable to see.
Okay.
And as for the optic nerve, once it gets damaged, it's not reversible.
Okay.
Yes. But there are certain types of low vision that can be enhanced. So
Alright.
the vision can be enhanced with some low vision devices.
Okay.
But pill disc, it cannot.
All right. Douglas from DC, because he asked questions in 4s and 5s, says there should be another program next week on the eyes. We'll give it some thought. Where we're waiting for our World Cup program. Sometimes the matches affect our programming, but we'll do our best. If it affects you, your health and your well-being, we will talk about it, and we'll bring in the professionals. This one says, I did not ask my question well. I was talking about optical shops which have sprung around our country treating patients they are not qualified to treat. This is the person from Moorfields in London who suggested that we look at other levels and maybe give them some enhanced capacity to do a limited range of function. But she's talking about those who are selling some of the products as well, the optical shops, as we call them. I like the way, and in the UK you will call it a shop. Come and see. Come and see whether it's a shop here. But we are shopping. We are shopping. I assure you, we are shopping. What's the purpose of the quick air puff or blowing air into the eye during the exam? Isn't that the one for glaucoma pressure?
Yes,
Yes,
it's one of
yeah.
the ways that we check the intraocular pressure, the pressure in the eye.
Yeah, they give you a blast. Boom. They love that, when they are making the things smaller, the things they ask you to read, and then they'll give you something. They say, "Hey, try this one, Charlie." With one lady, I had to, complain. I said, I've read that about the 4 of the different things. You are still going on. Why? She said she wants to be sure. All right. So the puff of eye, how does it work? So your eye will resist the pressure, or it will give a measure. How does that work?
Yes, it translates into a certain measurement.
Okay.
Yes.
All
So
right.
yeah.
It's not like ultrasound, is it?
No, that one is not
Okay.
ultrasound.
All right. Hey, please. It's not our territory. We eat tilapia and other thing. These are the people who do the eyes. So they've given an answer. Yes, it translates into and gives us an index of your eye
pressure.
pressure or
yeah.
ocular pressure, right?
Yes.
Yeah. Let's speak big words, and they'll give us a title very soon. So we've done justice. We've talked about glaucoma, cataract. Allergies are common,
Yes.
right? I hear lots of people talking about dust. Somebody says the eye feels sandy in the absence of sand, right? And all of those things. These are all things you hear on a common, regular basis.
Yes, very common.
So I mean, there are symptoms or people have dry eye disease, then they have all these complaints. It's varied. Some will say they feel sand on their eyes.
Okay.
Some will say the eyes burn and all of that. Yeah.
Okay. Right. The RP. We didn't talk about the RP. What's that?
Yes. So RP is retinitis pigmentosa.
You see why they use the abbreviation? You see.
Yes. So retinitis pigmentosa is basically
Say it slowly, please.
Retinitis pigmentosa.
Because this afternoon I'll use it on somebody. Retinitis
pigmentosa.
Chai.
Yes. So there's increased pigmentation in the eye, the back of the eye, the one we call the retina. Okay, yes. And commonly is an inherited disease. So it runs in families with various modes of or ways of inheritance.
Okay.
But it may also just occur on its own without it being in the family tree.
Okay.
And it commonly presents initially with night blindness. So the person is unable to see at night. You know, the eyes are supposed to adapt in a certain way at night.
I was just going to say, you're reminding me of
to be able to see.
Early days psychology where we do dark adaptation.
Exactly.
Right.
So there's dark adaptation in the eye as well.
Right. And it's not working well.
It's not working well with persons with retinitis pigmentosa.
Okay.
So initially they will be having symptoms of night blindness. But with time it progresses and gradually, even during the day, you can't see.
Okay.
Yes.
Right.
So it's a progressive disease as well.
Okay.
So, yeah.
So we'll leave it at RP because we are not qualified. But Dr. Nafisa Rita Mahama has given us a specialist definition that should help us. The heavy slap to the which causes us to see stars. We discussed that last weekend. I call it ear, nose, and throat because it covers all here. Right? It's the day in Maryland says it reminds her of her Tintin comic books where Captain Haddock used to say billions of blue blistering barnacles. Yeah, what was slapper? Now you start seeing he's all, he doesn't count them, he says billions of them. So all of these things can go wrong with the eyes. Okay? And I'm sure we'll have to find time and find out which of you can join us to do further education on these things, which maybe we take too lightly. Right? We should be looking at it. I can tell you the number of glasses that I've bent or damaged because it has to be somewhere on my bed. Right? You listening to, you know what I'm talking about. You wake up or you have to read something on your phone or anything, you need it nearby. Okay, which tells you the kind of deficiency in your vision that you're dealing with, which is being corrected with the lenses. Okay, so we need to understand some of these impairments and deficiencies and what is the appropriate and effective remedy for these things. So we'll be calling on your association again. That's the OSG, right?
OSG.
Yes. Yeah. Many thanks, Dr. Jifa, absentee. Overage, for lending all your colleagues to us. We really learned a lot, and we might be putting some people out of business, but it might be the right thing to do. People are looking for remedies, not shortcuts that will cause them more harm. Fixes. Right? Okay. So once again, Dr. Nafisa Rita Mahama. Right? I haven't left anything out. Thank you so much. She's at the Adan East District Hospital?
Yes.
Specialist ophthalmologist?
Yes.
All right. How long have you been out there?
Not too long.
Not too long. Okay, you were in Accra before?
Yes, I was in Kolebu.
Alex will go soon. And Dr. Alex Addo is a resident now. As soon as he started, we'll send him to Jellicoe, they do either. Or find some place, Golu or somewhere like that. Thank you so much for enriching our program. Thank you so much, my producer, Abeku Sankofi. The sports guys are revving up for a warm-up to the World Cup opening ceremony. Abeku should come and tell me what they'll be doing and how we're doing this switch. But hey, we are represented. We are one of the 32 teams. And I think our first match is on the 24th, Thursday, against Portugal. Right? Abeko, are we switching over now? Or okay.